What pillow we need to sleep on to prevent headache, muscle pain, shoulder, arm, neck discomfort. In this video, I show you the best pillow you can use to prevent all these abnormalities, have a relaxing normal sleep, and have productive day after that. My name is Dr. Rostrucheninov, and I am founder of Science Massage Institute located in Phoenix, Arizona. We work with therapists around the country and around the world to help them to be clinically effective in the complex clinical cases. One of the subjects is chronic headache, neck pain, shoulder pain. Patient in United States enters emergency room with debilitating headache every 10 seconds. So from that point of view, if the patient getting to emergency room, he already in debilitating state. How many patients has headache and they are not going to emergency room but simply suffer in silence? Patients need to be treated, and the reason for headache and cervical pain need to be eliminated by the therapist, and that's different subject. But what we'll discuss today, what patient need to do from the perspective of the sleeping. Why? Because if incorrect pillow choose for 8 hours of the sleep, it ruins all therapist efforts. And then therapist chasing its own tail because there is no stable outcome. There is number of the pillows, and each of them claiming stability and improvement. They are memory foam pillow, counter pillow, bamboo pillow, there is my pillow, there is pillow filled with the synthetic fibers. All of these pillows, they're enemy of the people. And at this point, when we in the clinic have patient with chronic headache and neck pain, I don't even start therapy until they get pillow we'll discuss right now. Otherwise, it's completely waste of my time and their money. I love my patients and I love my patients' money. That's why I never do anything if I'm not 100% sure in the effectiveness. So from that point of view, what pillow we can use? The ideal combination of the pillow will give hammock support at night, and that is 80% feather and 20% down, or 19% feather and 10% down. The better 80-20 combination. What it gives you hammock support at night, and more importantly, the weight of the head and force of gravity is not hitting neck during support at night. It actually targets base of the skull, because that's the first contact area which is sinking in the pillow, and the neck supported secondarily. All pillows I discuss about, counter pillow, my pillow, the position and the material which is inside actually target support of the neck as the first contact. That's what kills nerves which are leaving the spine and compromise the discs. If we switch positioning to the base of the skull, then the weight of the head and force of gravity comfortably sinking in the pillow, while the rest of the pillow support neck, but secondarily. And that decompresses cervical spine, and that decompresses spinal nerves. So I will ask our director of services, Julia, and we'll show you how to use pillow to sleep correctly. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you, and see you in the future. This is pillow I'm talking about. 80% feather, 20% down. And you can see here it has combination of feather, down, and air. That gives bouncing hammock support, which we use to gently cradle the head and neck during 8 hours of sleep. To sleep correctly, if this is headboard and this is the bed, pillow needs to be positioned on the edge. Patient head is not here. The patient head on the edge of the pillow. That gives you thinking and hammock support. Let me illustrate positioning. If the patient side sleeper, Julia will lay down on her side. This is incorrect position because her head and neck flatly on the pillow. What we will do, we will put it on the edge and we will put base of her head into the edge of the pillow, and you can see that secondary pressure and support comes from the part of the pillow which is secondarily in the contact with the neck, but majority of the pressure at the base of the skull that decompresses the neck, give cradle of the support for the neck. If the patient sleeps on the back, she put base of the hand again on the edge of the pillow. So here is first line of support, which is occipital ridge. This is the second level of support, which is neck itself. That's where all spinal nerves are. So from that point of view, when you're sleeping on the back, this is how you arrange the pillow. Let's say that you need to get into the bathroom at night. What you do, you just grab pillow before you laying down, and you just have couple pushes which put air inside of the pillow, and you use exactly the same positioning, which allows you to sink your head comfortably in the pillow for the cradle and hammock support. You cannot sleep on the stomach if you would like to prevent deterioration of the disc and the compression of the nerves. The sleeping on the stomach position kills cervical spine, and that needs to be changed. And from that perspective, you don't need to pillow to start with. But this is ideal support. There is question. If the patient has allergy to the feather and down, there is possibility of that. The closest you can get is feather down substitute pillow, which can be bought in Costco, for example. These are as close you can possibly get to the real feather and down without having allergy to it. So in both scenarios, you have natural and unnatural synthetic fibers support, but both of them almost equal. And all other pillows, and from my perspective, I have patients who come with their own pillows to demonstrate how greatly they are. They are not, because the counter pillow, it's not curving the spine, it kills the nerve. The my pillow or any synthetic fibers, pressure during the night make them harder, and they clench together, and that creates compression force on the neck, and that is endless therapies until correct sleeping pattern established. And this is why we would like you to consider that and try it on yourself, member of your family, and your patients, and you will see clinical benefits of that. Idea of orthopedic or counter pillow is to create or recreate natural curve of the cervical spine. The natural curve of the cervical spine is supposed to be restored not by the pillow, by the correct treatment. You cannot restore the curvature if the curvature flattened by the protective reaction by the patient brain. So this is what actually flattened the cervical lordosis, normal cervical lordosis, is protective reaction brain uses to decompress affected nerves and discs. And if we forcefully try to change position of the vertebrae by the sleeping on the folded towel, on the orthopedic pillow, on the counter pillow, we only applying pressure on the nerves and nothing else. Brain will not remove compensatory reaction, because that is tool brain used to protect itself from the additional stimulation by the pain analyzing system. Only when we restore the function, then we don't need to have restoration of the curvature by the pillow, because you need to have ideal hammock support at night, and that will give you peace of mind. What pillow you use and what your experience with and you can leave your comments below and we can have productive discussion about this important subject. Also, if you try feather down pillow or the feather down substitute, you can leave your comments below and share your experience with that. But in any scenario, if you already develop pain and dysfunction in the head, neck, and upper body, you will see significant clinical benefits. Some of our patients get rid of the headache even without our therapy. We ask them to sleep a week or two before the first appointment, and they're coming and they're saying, that's it, I don't have headache anymore. That's how powerful correct sleep at night can be for the normal life of the patient. Thank you, Julia, and we will see each other again in the next video.